Should you replace a missing tooth? Filling in the gap from a missing tooth allows you to avoid problems down the road. Your teeth are held in place by the other teeth in your mouth as well as the ligaments and soft tissues that surround them. Once a tooth is lost, there is no longer the same level of tension in your jaw that holds your teeth in the desirable positions. These subtle changes in your bite can make it hard to eat and chew properly. Teeth that are out of alignment are also more likely to be broken. You may also find that food particles tend to get stuck in the gap. Unfortunately, your risk of tooth decay and gum disease increases after you lose a tooth. As you eat and speak, the movements that your mouth makes send signals to the nerves in your jaw. They stimulate bone growth and retention. If enough bone mass is lost in your jaw, then you may also risk losing support for your other teeth. Today, treatment options such as dental implants can ensure that bone loss is minimized. Even a missing back tooth may alter how you speak or your ability to eat your favorite foods. Failing to replace a missing front tooth can also cause you to feel uncomfortable when you are in public or at a job interview. Ask about options for replacing a missing tooth. For instance, you may be a candidate for an implant that functions much like your regular teeth. Or you may prefer removable dentures if you anticipate future problems. Don't ignore a missing tooth. Call your dentist to find out your best options for treatment. Shumway Dental Care is committed to courteously treating patients with respect, honesty, and compassion, with only their patients' best interests as the highest priority. They were one of the selected top dentists in 2012 to 2017.